Hi there, it's Diane the Nursing Geek. This video is going to be a little different than some of the others I've done so far. It's going to be the first in a series of nurse-y content that I'm targeting towards writers who would want to know a little more about some of these things that are health or medical related in order to write a story in which these things figure. Could also be useful for anyone who's looking for overview level information. It's not going to get you past your NCLEX. Sorry, if you're a nursing student, you might want to go through it as just a quick overview, but it's not going to give you the level of depth that you're really looking for. But if you just are writing a story where your character is going to go into septic shock and you want to know what the heck is that going to look like and what are the markers that would define that, this is for you. First question then, what the heck is sepsis? The main resource that I'm using here is the Mayo Clinic, partly because it's just more up to date than most of the textbooks I have easily to hand, and I want to give the most up-to-date information that is available. So it's a complication of infection caused by toxins that are released by the bacteria that are infecting a person, and those enter the bloodstream, creating an inflammatory response which is potentially life-threatening. It has 3 stages: sepsis, severe sepsis, and septic shock. So let's look at the criteria or benchmarks you would hit, at least according to the Mayo Clinic. If you're a nursing student and you find that this doesn't match what's in your textbook, go with your textbook. That's what they're going to be using for your exams. But in general, known or strongly suspected infection plus at least 2 of the following. Get a temperature over 101 degrees Fahrenheit or 38.3 Celsius, or on the flip side, below 96.8 Fahrenheit, below 36 Celsius. I've mostly seen where they go into the upper range. I think you're probably heading into a more severe range actually if you're going that low that quickly. Heart rate over 90 beats per minute, and respirations over 20 per minute. So any 2 of those 3, plus the character is known to have an infection or is strongly suspected to have an infection. To take it to the next level of severe sepsis, you've got all of the above plus at least 1 organ is failing. So if it's kidneys, that's decreased urine output. If it's the brain, change in mental status. Could be confusion, could be delirium, could be unconsciousness. Other possibilities: low platelets, respiratory distress, abnormal heart function, or abdominal pain. Abdominal pain, granted, sounds a bit vague, could be anything, but if somebody's already in sepsis, any new abdominal pain is definitely going to be suspect that it's a sign of one of the organs in the abdominal cavity failing, and would probably bump the diagnosis up to severe, at least until they determine what the source of that pain is. And for septic shock, you've got all of the above, plus extremely low blood pressure that is not responding to fluids. One of the main things we do to compensate for low blood pressure is pump fluids into people. More fluid in your veins, higher blood pressure. If that's not working, then your veins are probably not holding the fluid. It's probably leaking out. The person is probably very swollen because all of this fluid is leaking into their tissues. They may actually be seeming to sweat out all of the fluids. It's not actually sweat, but that's how it would appear. So yeah, that's pretty serious when you get to that point. Obviously, if you are doing this to your character, you're doing it for drama. So you're probably not going to give them mild sepsis, which most people get better from, unless you start there and work your way up. Septic shock has a 50% mortality rate on the other hand. So, your character's in septic shock. What is that going to look like? Well, from the definition, they're at least trying to get fluids into the person, so they're definitely getting those via IV. And that IV could be running to a peripheral vein, meaning the ones you usually see like in the back of the hand or maybe in the elbow. Elbow's terrible, that one pinches off all the time, so probably the back of the hand. They're also almost certainly getting antibiotics by IV, because if they're that bad off, then there's no just swallow a pill every 12 hours antibiotic at this point. You just want it directly into the bloodstream. And they'll probably be getting a big gun antibiotic. We'll talk about those in a moment. And those cannot run to a peripheral vein for the most part, like the elbow or the back of the hand, where you usually see your wimpy little IVs that are for fluids and things. Those antibiotics are way too caustic. They have to go into much bigger veins, preferably right into the vena cava. So they will probably have a central line, which might be in the side of the neck, it might be in the upper chest somewhere, or what's called a pick. So it looks peripheral, but it's really central, going in through the arm somewhere, and again, it's been threaded through into the vena cava. There's a whole process of making sure via x-ray that it's in the right place before you start dumping massively caustic antibiotics in. If the person, the character, is in respiratory distress and it's severe enough, they're probably going to be intubated or on a vent. And again, if you're going for maximum drama, you're probably going to do this. And if they're in kidney failure, they're going to be on dialysis, because something needs to be getting those toxins out of your blood, or your blood is just going to ultimately poison you. So, yeah, something's got to do the job. If the kidneys aren't doing it, then the character will be on dialysis. Why is your character in septic shock? Well, odds are it's one of these three things. If you have the type of story going on where people get into big battles, then it's probably a battle wound that got infected. That's classic. If you're going for a different type of story, maybe it's that they're immunocompromised. Tough word there. They could be in treatment for cancer, because a lot of chemotherapy brings your immune system down. They might have human immunodeficiency virus. Wow, I can't speak today. They might have human immunodeficiency virus, or HIV. Or they could be on a transplant regimen, which, again, that's medications that are deliberately bringing your immune system down, in this case to prevent your body rejecting the transplant. Or they could be victims of a plague, a real one that exists in our world, or a magical one that you have invented. Honestly, one of the most common sources of sepsis that I have seen in my clinical practice was urinary tract infection. That's kind of boring, so you're probably not going to go that route, but really just about any infection can do the job. And if it's a magical one, you have the freedom to play around with it a bit and maybe do some things that a regular infection wouldn't, although if you're trying to be somewhat in the real world, like say you're writing urban fantasy, there can be a twist on it, but it should probably, to maintain believability and suspension of disbelief, have at least most things in common with how a regular infection would work. How will the doctors, nurses, and medics talk about it? Well, early on, they're probably going to voice concerns that the character may go septic. If they've just been brought into the ER or the field medicine tent or whatever, they may look at a wound and say, wow, that's likely to go septic. They may call it septicemia. That word seems to be getting used less and less these days from what I see, but then again, I'm not in the ICU, so I don't know, maybe they use it more often than I think. And if you've got a world in another planet, out on a spaceship, some parallel universe, you can go ahead and invent your own term for what this is. what antibiotics will they use? So again, assuming we're in more or less this world, these are the 4 you're most likely to see thrown in there. Vancomycin, or Vanco, which is used for particularly resistant gram-positive bacteria such as Staphylococcus. You may have heard of MRSA, that's methicillin-resistant Staphylococcus aureus. Definitely used for that rather often, although that has mutated to the point that it is frequently also vancomycin resistant. Clostridium difficile is another one, aka C. diff. Rocephin is often used because it covers both a number of gram-positive and gram-negative bacteria. Aztreonam covers specifically gram-negative bacteria. And ciprofloxacin kind of doesn't matter if it's gram-positive or gram-negative, but there are some bacteria that are just better off attacked at the protein level rather than some of the methods that these other antibiotics use. And so that's often thrown into the mix, especially if they don't know what the infective agent is. It takes 2 to 3 days to grow a culture that you can actually find out what is causing the infection. And in a really fun scenario, you can't find any bacteria every time you run a culture. And so you think it's an infection, it looks like an infection, it behaves like an infection, but you can't actually find the source of the infection. If this sounds like the voice of experience, yes, have recently been through this with someone. So in that case, they're just going to throw the kitchen sink along with everything else at this mystery infection. And if you're really going for maximum drama, that would be a way to go, because I will guarantee you that gives you maximum drama when all the doctors and all the lab techs and everybody can't figure out what the actual infection is and why nothing they are throwing at it kills it. So you'd probably see Vanco, Cipro, and then one of those 2 middle ones, at least. On the other hand, if you got a really specific one, a specific bacterium that fits your story for whatever reason, then it would probably be just one of those, or perhaps a different one entirely. I will give you the InfuServe America link, so you can see what they have there and do a little more research into what would fit your story. So, will your character survive? Ultimately, the answer to that question is what fits your plot and this character's arc. Because remember, the mortality rates, even for the septic shock level, it's only 50%. People tend to expect it to be close to 100. It's not. It looks really bad. It is really bad. And 50% mortality is not a good thing. But your character certainly does have a chance to pull through. And if for some reason you only hit them with mild sepsis, then they're pretty much getting better with treatment. Okay, so that's it. If you have any questions either about this topic or about another topic you would like to see covered, please pop it in the comments. I will have all of the references that I cited in there down in the description box. And other than that, I hope you have a great day, and I'll see you next time. Bye.